Hey everybody, good evening. This is Ramina Zarm from Flex to Success Clinical Rehabilitation Services, and I'm doing a video tonight on obsessive compulsive disorder. This one's really interesting because there is a multitude of illnesses that fall under the umbrella of obsessive compulsive disorder. The first one is body dysmorphic disorder, or a disordered perception of your body image. That one I will do a full video on, as well as all the other ones I mentioned. The second one is hoarding disorder, or storing an excessive amount of goods or products in your home, stacking them to the ceiling, and continuing this behavior to the point where it becomes an actual safety hazard for an individual to continue living in their home. Because if there's a fire, or if someone needs to get in the house because of an emergency or a crisis, they actually won't be able to, because the hoarded goods are going to block all the entrances and exits to the home. So it's going to be very difficult to engage someone if they're having an emergency in their home if nobody can get in. The next one is trichotillomania. So any type of body hair, hair on your head, eyebrows, eyelashes, mustache hair if you have any, arm hair, leg hair, hair in all your private areas, you're going to try and rip all those hairs out of your body. It's an obsessive illness where you want to remove all of your body hair at all times. It's a self-harming disorder because when you're pulling out all these hairs from your body, like, you could break blood vessels and leave blood spots as you're doing it, which can induce pain chemicals, which can change the way that you feel. A lot of times when we inflict pain on ourselves, we get revved up, like our heart rate increases at first, but then we have a scaling down time after the pain has subsided where we relax. So a lot of times when people are suffering with internal pain, they'll hurt themselves on the outside, trigger the pain response, just so that they can enjoy that scaling down somewhat of an opiate effect, of where the receptors have secreted, the neurotransmitters have secreted, and now they're calming down from that synaptic interaction that was taking place inside their body. Their body goes through like a relaxation period, and then they cool out. After trichotillomania, there's also excoriation, also known as excessive skin picking. And this disorder is interesting because what you'll do is you'll actually just repeatedly, excessively try to pick all the skin off of your body. Anywhere where there's skin, which is pretty much all over your whole entire body, you'll be trying to pick that skin at some point in time. If you have a scab, sometimes it makes it worse, or a cut, you'll sit there and dig at it, pull the scab off. It's bleeding, you don't care, you're still going, you're trying to pick the skin off around it. It's a very excessive skin picking disorder. That's another form of self-mutilation, which again causes that pain response, which then leads to the relaxation period after the synapses have interacted and excreted all of their neurotransmitters. So after excoriation, we have substance medication-induced obsessive compulsive disorder. This involves using drugs excessively, repeatedly, chronically. A lot of our addicts that are in our rehabs all across Long Island are experiencing some form of substance-induced obsessive compulsive disorder. Addiction itself has an obsessive compulsive component to it, and we'll get into that later when we do a video on that, but for now I just want to focus on the basics of OCD. So, what is OCD? How do we define it? OCD, also known as obsessive compulsive disorder, so we don't get confused, is a mental illness that involves repeated unwanted and/or irrational thoughts, fears, sensations, images, thoughts, and/or the urge to physically engage in repetitive behaviors or actions. So let's break down that definition a little bit. So when they're talking about repeated unwanted, thoughts, urges, images, fears, sensations, what they're actually talking about is they're talking about obsessions. When you're obsessing over something, those are the different things that you're experiencing that cause you to obsess. So, anything that you're obsessed with, you're going to be having unwanted urges, sensations, thoughts that are kind of intrusively coming into your mind and forcing you to think about them repeatedly. Then when it talks about the actions, the repetitive actions, those are responses to the obsessions or some derived set of rules that you have for yourself. So any type of action is a compulsion, repetitive action is a compulsion. Any type of repetitive thought or anything like that happens internally is an obsession, right? Thoughts, urges, images, sensations, fears. So that kind of jumps me to my next thing where we define obsessions. So obsessions are recurrent and persistent thoughts, urges, or images that are experienced for more than 1 hour per day. So it's basically everything I said before, but in order to get the diagnosis of obsessive compulsive disorder, these things, these obsessions and compulsions, they have to occur for at least 1 hour per day on a daily basis in order to get the diagnosis. And compulsions are repetitive behaviors such as hand washing, ordering, checking, or mental actions such as counting, praying, repeating words silently to yourself. Those are all examples of compulsions that people will have when they're suffering from OCD. And there's also a drive to want to perform these in response to either an obsession, like we said before, or a set of personally derived rules that you have for yourself. So just to give you an example of that, if I tell myself that I have to open and close the door 3 times before I can leave the house, that's an example of a personally derived rule set which leads to a repetitive action that I have to complete in order to feel like relaxed and calm and soothed, right? So that would be an example of a compulsion. Another example of a compulsion would be I have to take 6 showers before I'm clean. You know, most people can just take 1, but like somebody with OCD, they might make an irrational rule set for themselves that says, nope, I have to take 6 showers. If I don't take 6 showers, then I'm not clean. And if they only take 5, they're going to have this anxiety and this feeling of nervousness and uncomfortability that they're not clean. And they're going to want to take that 6th shower, and they're not going to stop thinking about it until they take it. So it's a very debilitating disorder. It has many components to it, and it affects many aspects of life. One talk therapy that works really well with obsessive compulsive disorder is cognitive behavioral therapy. And what that actually does is it takes the compulsions that you have that are very irrational and not really working towards any type of usefulness in your life, and it tries to replace those compulsions and obsessions with either thoughts or actions that are helpful to you in your life. So instead of opening and shutting the door 3 times before you leave, maybe taking a shower, brushing your teeth, and making sure the stove is off, right? Like you can just take the pattern of behaviors that you're doing that maybe are somewhat wasting time for you, like taking 6 showers, and you can replace it with a multitude of other things that include activities of daily living, like brushing your teeth, doing your hair, making sure you go to the bathroom before you leave the house, setting out your clothes the night before you go to work, right? Like all these things would be helpful to encourage you to be a more productive person throughout the day, rather than just opening and shutting doors over and over again, which doesn't really do much except for wear and tear on the door that you're opening and closing over and over again until it breaks, right? So cognitive behavioral therapy will try to turn your obsessions and your compulsions into more useful behaviors and thoughts so that, you know, you can be a more productive person in society. And then different medications that are effective in dealing with obsessive compulsive disorder are antidepressants. And the reason for that is that obsessive compulsive disorder, for some reason, a lot of people that have it seem to have low dopamine production. And antidepressants tend to boost your dopamine production. So higher levels of dopamine equal less intense obsessions and compulsions, which equal a happier person. So medications like Paxil, Zoloft, what else works really good? Fluvoxamine, or also known as Luvox. Those three I know for sure have done pretty good job with obsessive compulsive disorder. I've actually been in therapy with people who are on those medications, who were diagnosed with OCD, and I did see improvements in them when they were taking those medications consistently. Problem is that a lot of people out there, they'll take their medication for a week and then they'll go off it, and then they'll take it for another week and then they'll go off it, and then maybe they'll take it for 2 weeks straight and then they'll go off it. And people just tend to have a fear of, medications and pills in general. So people are afraid to take these things consistently, and if you don't take it consistently, it's very hard to see if it's working or not, because there's not enough of it in your body to actually cause enough of a response to counteract your symptoms of OCD. So, you want to take your medications consistently, you want to follow the way it's prescribed. You don't want to think that you know better than the doctor, and if you want to make any changes to your medications, you definitely want to talk to your psychiatrist about that before you do it. So that's my presentation on obsessive compulsive disorder. I hope you guys enjoyed it. If you have any questions, leave it in the comments below. I know that this is a very popular one, and that a lot of people kind of deal with either a mild form of this or a more moderate or severe form of it. So I wanted to make sure I did a video on these, and I'm going to touch on every single one that falls under the umbrella of OCD as well. And hopefully I'll get some responses from you guys, and we can have some interesting clinical conversations online about OCD and maybe some of the other illnesses that I post videos about. All right, thank you everyone for listening. Take care. Have a great night. Enjoy. This is Ramin Azarm, LCSW, signing off. Have a good night. Bye.